Welcome and thanks for joining us for this edition of Scope. A health expert is forecasting that the fourth wave of COVID-19 will hit the country in March 2022. Port Moresby General Hospital Acting Director for Medical Services, Dr. Kone Sobi, said his projection is based on the first, second and third wave as well as models from across the globe. While we brace ourselves for what is yet to come, the question is how prepared is our health system to withstand this surge?
The first, second and third wave of the COVID-19 has left our health system struggling to keep up. The third wave was the deadliest. The Delta variant caused sick patients to flood hospitals. The National Control Center reported over 400 deaths from the third wave. While health services were scaled down, morgues were filled to capacity. Port Moresby General Hospital Acting Director for Medical Services, Dr. Kone Sobi, in a press conference, predicted that the fourth wave will hit the country in March 2022. He said the projection is based on the first, second and third wave as well as models from across the globe.
What we also know is that from the first surge in July 2020 here in the city, again it lasted for about 8 weeks to 3 months. And then the second surge in February this year, and then third surge in September this year. So the surges are occurring about 6 months apart. If there is any means for us to be guided, we expect another surge around March, April next year. But we just work towards mitigating the devastating effect in terms of the severity and the huge numbers of people that present to the hospital.
Dr. Sobi said in the last 8 weeks, since the third wave began on September 8th, Port Moresby General Hospital has attended to over 1,000 patients seeking medical treatment, most of whom had breathing problems.
We hit the peak of the surge around the 18th, 19th of October. And as we have learned from the surges and the models across the globe, and certainly here in PNG, this was our third surge in National Capital District. And we know that the surges last anywhere from 8 to 12 weeks, depending on the situation, the behaviors of how people in terms of movement and so forth. Vaccination will add to those periods of surges. At the moment, we are on the down 10. We've seen so many deaths. In the last eight weeks, we have reported about 200 deaths in the hospital. We are also aware of more deaths that have occurred outside of the hospital, but for several reasons we have not carried out testing. We respect the wishes of the families, but we are also mindful of the fact that there are deaths that occurred outside of the hospital and that didn't come to our hospital systems. So the number of deaths in the last 8 weeks may be underestimated, but what we need to realize is that in these 8 weeks, our system, the hospital system, was significantly challenged, unprecedented. We have not seen so many patients on oxygen by any one single disease before.
As we brace ourselves for the impact of the fourth wave, how prepared is our health system in withstanding this surge? Deputy Pandemic Controller Dr. Ezram Downey said if the country achieve herd immunity or an 80% vaccination population, we can rescue our collapsing health system.
The very important trend and feature we are seeing is most of our deaths and people who are ending up in ICUs are the unvaccinated one. So you can say that currently the epidemic in PNG is tracking towards an unvaccinated pandemic. Fiji and Australia are opening up at the end of the year. If we can mobilize everybody in PNG to get vaccinated and we reach 80%, I can guarantee you that we'll relax a lot of these restrictions. We have too many skeptics out there. Please don't listen to those skeptics. Get yourself vaccinated. It will protect you and it will protect your family. I've had a lot of unpleasant conversations with some of my colleagues in the hospitals, and they've told me some very frightening stories. People crying on their deathbed to be vaccinated. I'm sorry, but if you get vaccinated on a deathbed, you will not survive. Okay, you cannot be fully vaccinated by a single dose, and let alone being vaccinated, you have to wait for at least 2 weeks to a month to be fully considered vaccinated.
And so I think we need to adhere to those simple measures: hand sanitization, face mask, and most importantly, again, vaccination. In that way, we'll be able to at least mitigate those devastating clinical effects that the hospitals put under. So it's a health crisis. Let's manage as best as we can to deal with those health issues so that it doesn't spill over, transcend into socio-economic disaster.
When we come back, village birth attendant travels kilometers into Morobe's capital in search of medical supplies. Tinola Mana shares devastating health situations and complications in rural Manyama. A village birth attendant from a remote village in Manyama district, Morobe province, made a grueling trip to Ley seeking help for her local women. Tinola Manas from Poyu village said village birth attendants use plastics, bamboos and bush ropes to deliver babies. Here is the story produced by Ley-based reporter Kamela Guare and narrated by colleague reporter Jemima Sukpat.
Tinola Manas has been a village birth attendant for over a decade, serving the women of Poyu village in the Nanima Kiraba local level government of Manyama. Basic services are non-existent in her village, while their aid post is only a building with nothing inside.
Levi po mama misa lokit dis lausen. Time dol kareng. Yo kawam lang gu plastic. O sakari lo toilet, o sakari lumbus, o sakari ani klaus plumi. Yo kagu plan bed. Sakari. Blo mi pla olvi beto mi pla lawo kem no at hand crab no kasu tulo mi pla werin. Mi pla sa pasim sewing plastic na bawat mi pla sa walk roll mama. Mama baby sa kam lo hand, baby sa kam lo leg, no kat kal, no help him. Just leave mama osa looking. Sem blood ball mama to him sa ko out, mi pla to help him all. Mi pla work ko kisim ole no kat osa tay na mi lolot. No kabam bla kal stop to help him mi pla.
Mana said pregnant mothers sometimes get swept away when crossing the river to reach VBAs. And the same happens to VBAs who cross rivers to assist mothers in labor.
Wala sa kare mi pla ko, wala sa simbaket mi pla ko. Tos mi pla lepi mo mayam sa kare mi pla ko. Kam long well patim la wote o sa kam lo mi pla. Emosem ikat bi pla wara. Mosa to kola kapa. Ol bi pla wara. Lek wara namel wara et wara. Sa big wara yam sa ol mama sa blukin trip hap. Na bola sa kisimuli ko. Na mi pla stop inside the bus. Olman, mi pla stop inside the tutaket. Na mi pla sa mi pla ol vipe mi pla serim ol namba plong kapman tasong kapman no sulukruk kung mi pla lo kain ol mama lo bus. Islam no kat. Heavy pla kapman tasole mi pla sa plan mi pla sa dai.
Mana said their nearest health facility is the Poyu aid post, which is yet to be equipped with the necessary health supplies.
Mi pla kat man start. Tapos sa housik ligre ka housik inong gupla housik. Aw mi pla start. No ka wan blang gupla VP house do karim no kat. No kat it.
Poyu Ward 8 Councillor Jex Mena supported Mana's concerns, saying they have lost many women.
Mi plus la plan yes kapman no look man isla kapman no kat han isla. The time women's lab am coming say then panim sa road. Na mi one bed to isla road and one bla. easy plan. And the helping plan is lifelong mama place. So, road long plan to know right. People like try saving on mama law sick because I find it hard. People look at ambulance. So plan the lifelong mama bell mama is a loss. So this like total women's level make him the year. Me too, me find him road. Me work councillor. Me try and find him road help him, but me say short for because our leaders want to start prostate lo me bla. Me also community leader lo word na. Me look at financial power. Lo delegating mo sa kind wo.
Tired of being neglected, Manas came to Lay seeking assistance. Morobe's Division for Community Development helped Manas by writing a letter to the Good Samaritan Foundation, a charity branch of No. 1 Hayaka, to assist with birthing kids. On Wednesday, the 3rd of November, the company's operations manager, Luke Bere, presented birthing and cleaning equipment to Manas, who was also recently appointed to represent women at ASECI.
Miss Eromas long guide na small equipment na kami lagi ibig mesa ama mas block company lo halu work long community development mi plasaro sin yaman ni sagat ang blame badi gasa also tamam so all mission staff but at this moment at least mi platu mas cheap halu mission.
Manas gratefully received the donation with Poyu Ward 8 councillor. Items given included buckets, mats to use as birthing beds, scissors, gauze, clamps, sanitizer, aprons and gloves. Manas prays to see the day when VBAs no longer have to struggle alone to help pregnant mothers in remote areas.
Me want that. Mi blar mama nampa piminta. Ol man mi sakari mo le bipla nampa. Why ono sa piminta ol man. Sakara ya mi puti lan dong mi. Na mi tingo sa waray pa mi ko na tinga no kat. Ekat keke plongan na mi mamas. Na cancel pa mi mamas na mi mi kame. Why mi plus ol mama mi plus a. Okay, man la kama kapman ya, la kama policeman ya, la kama amia. Mi sakari mi lo toilet ya. Misa kare mem lo bus ya. No ka good house. No ka good house, no ka good light. Misa lighti man bo sa singaw timi. Try pa na ito sa lingi mi. Mi no ka good phone. Na misa lighti man po na misa golol man. Try pa night. Wala sa kare mi ko sa puli mi lo wala. Lo wane mo to ki mi yo mas dai man to. Sa tindi mi.
After the break, winning coach with the Lay Snacks Tigers, Stanley Tepend, has moved up the ranks as the assistant coach to the SPPNG Hunters. Tepend shares his coaching experience and what he hopes to gain in his new role. Welcome back. Lay Snacks Tigers coaching guru and newly appointed SPPNG Hunters assistant coach Stanley Tepend has taken his new role with both hands as team and coaching staff assemble in Port Moresby for the start of the 2022 pre-season training camp. Tepend recalls out of 14 applicants who applied for the PNG Hunters head coach position at beginning of the 2020 season, he was shortlisted for the top job but missed out. A decision he fully respected, admitting a lot of things did not work out the same year, even losing the grand final to the Hella Wigmen. For Tepend, he always believed in perseverance, patience, and hard work. After another stellar season with the Tigers taking out his fourth premiership title for 2021, Tepend admitted when the SPPNG Hunters board approached him to be assistant to Matt Church for the 2022 Intra-Super Cup season, he could not knock back the offer.
Cuts out one and finds Malpaya. Is in the clear. Malpaya has made a bust. It's got the ball on the inside. Back to Valley Maxi. And he says bye-bye. Wow, what a put down. The Tigers. And that should be it. The Tigers already celebrating.
When one door closes, another one opens. For outgoing Lace Next Tigers coaching guru Stanley Tepend, getting the SP-PNG Hunters assistant coaching job did not come as a surprise, being initially one of the top contenders for the Hunters head coach position in 2020. His latest appointment was purely on merit and attributed to perseverance, patience and hard work.
The timing this year, I think it's probably better for me, and at this sort of being able to work with Matt, and I think it's good too that Matt's been given another year, so instead of me just taking over fully, I respect that, and I think it's better for me to learn as much as I can and work with him, work with other coaching staff as well, and and the other good thing is we're all based in Australia, so that's probably an advantage to Matt too, where for me to take that on board and be with him and help him as much as I can.
Before he officially assumed his new role with the Hunters, Tepend recaps on his longevity and illustrious coaching journey with the Tigers and the challenges.
When I started, I think the Hunter system obviously wasn't there, but I'm just grateful over my time when I've been at the Tigers over those 9.5 years. Rugby has grown, the development of rugby, PNG Rugby League has done a great job. The Hunters program, all the other programs as well, the Digital Cup has improved. So over my time with the Tigers during the Digital Cup, I think at first I had to learn a lot of things, but as the years progressed, I think I've learned a lot in how our way Digital Cup has improved, and then that's probably made me a little bit smarter, having also been around and constant or staying with one club for 9 years. I think that's helped me a lot, and the success just comes from the not giving up, but just staying constantly for those continuous 9 years. So every year I think we've improved ourselves. So that's probably been my sort of growth as well, becoming a coach, and also learning a lot along the way. There's always new things that I pick up along the way, so that's helped me a lot, and now I think it's the right time for me to go to the next level and help the Hunters and Matt Church.
Tepend said being with the Tigers from day one, he's been a one-club man and proud of the culture and systems that they have built over the past 9 years. He admitted he did not know much at the start, but over the years he was able to learn a lot of new coaching styles and techniques and how to coach smarter. When asked about the Tigers' next chapter after his departure, Tepend was very confident the club is in a better place to continue to build on the legacy that he's established during his 9-year tenure.
I think the club is a really good place at the moment. Over the last 9.5 years, we've really worked hard, not myself, but all the other coaching staffs. Some have gone to other clubs, some have gone to one of them is currently at the Hunters, but I think all the coaching staff have worked hard, plus the sponsors, to get the club to where it is now. And for me, leaving should not really change much, because the things that matter to us most, or the club, the things that make the club successful, will still be there. I'm just one person that's going, whoever the next coach is. I think we've done our work to make sure that the club will be healthy, the club will continue to be successful. I think there's a lot of things that people don't see that happens. I take a lot of the credit because I'm the coach, but a lot of work behind the scenes gets done, and those guys that work hard and keep the club running will still be there. So I think the club will still be in a good place, and there's a lot of young players that we used this year. They'll be better for it in the second year, and there'll be a couple of other senior guys there too, but I think the club's in a really good place to hopefully keep the success going. It didn't start easy, but we've done well each year to make sure that we're up there, and I think those same cultures and principles will be still delivered to play as strongly as I do when the new coach comes in. In terms of coaching, I think Oscar Tonga is ready to coach the side, and with a lot of that support staff around him. So I think the support staff, the people that help Oscar, will be important. He will be just taking most of the limelight, but the support staff that works with him, which no one is missing from last couple of years. So I think Oscar Tonga, I'd be recommending Oscar to the sponsors and that to have the driver's seat when the coaching role is up.
Tepend, who joins Church and Paul Ayton on the Hunters coaching staff, was grateful for the opportunity to be part of the team in the Interest Super Cup.
Nice. Release. That's it. That's all you want.
Hunters coach Matt Church has also welcomed Tepend into the Hunters pack, saying Tepend's coaching record is unmatched in PNG. Church said it is Tepend's opportunity as well to gain valuable experience at the Interest Super Cup level. Meantime, the team is currently in pre-season training. They will relocate to Queensland early next year for the 2022 Interest Super Cup season.
And that ends another episode of Scope, a kind reminder to apply simple measures to prevent transmission of the coronavirus. Regularly wash your hands with soap and water, cough or sneeze into your elbow, and exercise social distancing. If you are feeling sick, please stay at home. You can also call the COVID-19 hotline number for more information or assistance. Thanks for your company. See you in our next episode of Scope.